When you're talking about the geriatric psychiatry, it's again very important to focus on the sleep disorders that the people basically that are belonging to this age group, that is more than 65 years of age, they're suffering from particular kinds of sleep disorders. It can be the insomnias, or even it can be difficulty falling asleep. Now, what are the factors that are basically causing these sleep disorders? It's again very important to discuss over here. Can be the multiple factors ranging from the basically the ailments that the person is suffering from, and then there can be the environmental factors of the individual as well. The person can be suffering from some sort of anxiety disorders that can also manifest as these sleep disorders in these individuals. So when we talk about and discuss these sleep disorders, first of all, we'll go through the epidemiology of these sleep disorders in these individuals, and then we'll move on to the normal sleep pattern. So knowing the pathology, when you basically are going to discuss the pathology of anything, one should know the normal rhythms or the normal circadian rhythms of the sleep pattern to know what is basically abnormal, or to distinguish between normal and abnormal. It is again very important to know what are the normal criteria of the sleep pattern in an individual. So we'll be discussing this normal sleep pattern, which is usually observed for these people in this particular age group. So this normal pattern even varies from age to age. It can be different for the adolescents, it can be different for the childhood, and it can be different for the people who are belonging to the geriatric age group. So changes in the old age will be discussed, and these changes are basically physiological, and they are not going to be considered as abnormal changes for a particular individual unless they are hindering the day-to-day life activities of that individual. If the person's health is basically being compromised due to these sleep disorders, then we're going to consider them to be abnormal, and then the treatment guidelines have to be manifested in these individuals as well. So basically the epidemiology is regarding 20 to 40% of older Americans experience insomnia at least a few nights per month. So it's the common rate or the common epidemiology that is observed in a particular culture. 2 by 3 of the elderly in the institutions, they experience the problems with sleep. Then we have insomnia, that is basically difficulty falling asleep, 18.1%, difficulty staying asleep, that is 18.6%. Then we have that is basically not feeling restored by the sleep, that is almost 30.9%. So these are basically the percentages relating to the difficulty in falling asleep. So these have to be kept in mind when you're basically taking the history. It's again very important to note down these factors as well in detail. Knowing the normal sleep pattern is again very important over here. After the sleep onset, it's again very important just to have a look that basically it takes almost 2 to 3 hours to be in that deep phase, or to be in that deep cycle of sleep. So the sleep onset is again very important to focus on, and then the sleep usually progresses through the non-REM stages 1 to 4 within 45 to 60 minutes. We have the REM stage, which is basically the rapid eye movement stage, and then we have the non-REM stage, which is basically known as the deep sleep. So the deep sleep basically occurs almost 45 to 60 minutes after the REM sleep. So this has to be kept in mind. And then we have the slow wave sleep. It predominates in the first third of night. And the non-REM sleep is basically the stage 3 and the stage 4 of the sleep cycle. 15 to 25% of the total nocturnal sleep time in the young adults is basically the non-REM sleep that we're talking about. So they have a more deeper sleep than the older individuals. The first REM sleep episode usually occurs in the second hour of the sleep. So changes in sleep with age, they are quite common. Light sleep, that is stage 1 and 2, it increases with age, and there are more awakenings. They're basically more awakened by even the light noises in the surroundings or in the environment. They basically become more sensitive. The deep sleep, that is stage 3 and 4, it decreases from 25 down to 3% of the total sleep time. So these are the normal or the physiological changes that are observed in the individuals when they age accordingly. So the depth of the slow wave sleep, it decreases with age in these individuals. And then we have the healthy older person. Basically, the slow wave sleep may be completely absent, particularly in the males. So these are the common variants. Decreased amount of the REM sleep is observed. The sleep quality and the efficiency is 70 to 80% of the young subjects in these individuals. Changes occur in the day and night cycle. This day and night cycle is also termed as the circadian rhythm in these individuals. So even when you age, with the passage of time, basically the circadian rhythm is also going to be changing with the passage of time. Circadian rhythm disturbances, they are basically regarded as the 24-hour physiological rhythms that are quite common in the individuals. They're affected by the hormones. The core body temperature is again going to affect the circadian rhythms. And then we have the sleep-wake cycles. Even these sleep-wake cycles or the deep sleep cycles, they're going to be affected by these circadian rhythm disturbances in these individuals. In aging, the sleep-wake cycle advances due to changes in the core body temperature, or the other cause can be the decrease in the light exposure. So these are the causes for the changes in the circadian rhythm in the older individuals. Now, if we have a look at the circadian rhythm over here, now it's basically the standard phase. It's basically starts from 11 p.m. to almost 7 a.m. And then we look at the patterns that are basically on a change factor. It can be they go to sleep early at almost 6 p.m. and then they wake up early. That is almost at about 5 a.m. So these are basically the changes that can be noted with the passage of time. They go to sleep early and then they wake up early in the day or almost around 5 a.m. So these are the changes that can be observed in the older age group people. The decline in hours slept by age. So it's basically a diagram that is showing how basically there is a decline in the hours as we see as a person ages. There is a decline in the hours seen. So it's almost around 5 hours of sleep when the person is almost 80 years of age. That is observed over here, compared with a person who is at almost 30 years of age. He sleeps almost 8 hours a day. So this is the normal pattern that is seen in the individuals. And when we look at this pattern, it's quite physiological. There is no abnormality seen in this. If a person at an age of 80 years, he or she sleeps for 5 hours, it's a normal pattern that is seen in these individuals. So the impact of the disturbed sleep is again quite common in these individuals. The difficulty staying awake during the day, and then we have the impaired attention. Slowed response is even seen in these individuals. There is an impaired memory and concentration. So these are the effects, how it is basically going to affect the lifestyle of the individual. There's going to be a decreased performance seen. The mortality is due to the common causes of death that is 2 times higher in these older people. So in this section, basically, we summarized the sleep disorders in the geriatric age group people and how do we go about and evaluate these individuals. So that is the end of this section. Thank you for watching sqadia.com.